everyone, my name is Shalom Tucker and welcome to my study review video. The title of the article that I will be presenting you today is Combined Lifestyle and Herbal Medicine in Overweight Women with Polycystic Ovarian Syndrome, PCOS, and it is a randomized control group. The researchers focused on examining alternative treatments for women with PCOS and excluded pharmaceutical treatment such as contraception pills, focusing on lifestyle intervention and herbal medicine intake for treatment to women with PCOS. Prior research reports low satisfaction rate among women with PCOS who use pharmaceutical treatments such as contraception pills. PCOS is one of the most common causes of infertility. There is no cure as of yet for PCOS, and it comes along with a long list of symptoms. Authors suggest that herbal medicine along with lifestyle intervention may be more effective and affordable for participants and for women all around the world who suffer with PCOS. This study was performed in Australia, and researchers used Facebook advertising, referrals from health providers, and gynecologists to recruit women. Participants included women aged 18 to 43 years old who were diagnosed with PCOS according to the Rotterdam criteria and had a BMI greater or equal to 24.5. The excluded criteria included any women taking estrogens and or progesterones to regulate menstrual bleeding or who were taking antidepressants. This was done to avoid any potential negative pharmacogenic interactions with these pharmaceuticals and the herbal medicine. The targeted sample size was of 189 participants who were diagnosed with PCOS and had a BMI greater than or equal to 24.5, but the actual sample size was of 122 participants who were selected after meeting eligibility criteria, providing written consent, and enrollment. This sample size was split into two groups. Group 1, a number of 60 participants, and Group 2, a number of 62 participants. Group 1 was the lifestyle intervention group. They were required to complete a calorie-controlled diet within a healthy food choice setting, exercise for a minimum of 150 minutes per week, including 90 minutes of aerobic activity. And this group had access to lifestyle coaches throughout the trial. They were contacted every fortnight, were invited to attend supervised exercise sessions, and were personally helped in constructing their own personalized lifestyle plan. If any of these women were to become pregnant, they were advised to continue the lifestyle intervention and to avoid increasing the intensity of the exercise until consulting with their obstetric care. These women were also advised to cease from taking the herbal medicine tablets because of the unestablished safety of their use in pregnancy. Group number 2 was a lifestyle intervention and herbal medicine group. This group were required to complete all the assignments as group number 1. In addition, they were given 2 different bottles of tablets of herbal medicine. Tablet 1 was administered 3 times a day throughout the trial. Tablet 2 was only administered in the follicular phase of the menstrual cycle. The dosage for oligomenorrheic women was of 3 tablets a day for 10 consecutive days starting on menstrual cycle day 5, and dosage for women with amenorrhea was 3 tablets a day starting within 1 week of the trial commencement. Participants and clinicians were aware of each group assignment and therefore not blinded, but the analysis was undertaken blind to group allocation. The data collected from the participants by the researchers was number of days in menstrual cycle. This was self-reported using printout charts or digital charting services. Hormone levels were assessed before and after. Blood collected between 2 and 10 days of menstruated cycle or within 1 week of the trial for women without menstrual cycles. Insulin sensitivity was assessed before and after trial. The body weight, waist and hip circumference, BMI, and waist to hip ratio was assessed, measured before and after trial. Polycystic ovarian syndrome questionnaires were filled out by all participants. Depression, stress, and anxiety were assessed using short forms. All participants were required to fill out these forms. Pregnancy and live birth outcomes were collected by each participant. Blood pressure was taken at 4 and 8 weeks. The compliance was measured by tablet count within the return of content of herbal bottles at 3 months. And the lifestyle intervention participant compliance was assessed fortnightly and through an interview at week 12. Women self-reported their exercise intensity. They self-reported average number of fruits and vegetables eaten and self-reported of meals consumed a day at the end of the trial. The outcomes that the researchers were looking for was any reduction in depression and or anxiety, loss of body weight, duration of menstrual cycle, and increase in conception rates. Study findings. Statistically significant study findings were that menstrual cycle length was lower for women in the herbal medicine group than for those in the lifestyle intervention only group after the trial. Women in herbal medicine group had a significantly lower waist circumference and BMI than the women in the lifestyle intervention only group. The follicular phase was increased for women in the herbal group. LH was lowered in the herbal medicine group. Fasting insulin was lower in the herbal medicine group. Improvement for systolic and diastolic blood pressure for women in the herbal medicine group. Women in the herbal medicine group also reported a greater reduction in depression, anxiety, and stress scores. The non-statistically significant results or findings were that there was no significant difference between groups for reproductive hormones, testosterone, SHBG, or FAI. So no differences in the results in group 1 or group 2. There was no significant differences between groups for waist to hip ratio in either group 1 or group 2. Further research questions. This research did not include a placebo group. Researchers expressed a need for further research that contained 4 groups, 1 placebo group, 1 group that solely did the intake of herbal medicine, a 3rd group who participated in the lifestyle intervention solely, and then a 4th group that did both lifestyle intervention and herbal medicine intake. There was a lack of the authors expressed that the lack of blinding could have influenced the estimated treatment effect size. Authors expressed the need for further research with blinding. The trial only went on for 3 months. Authors expressed a need to further investigate over a longer duration of time to examine the sustainability of the outcomes. This is the presentation of my article. Thank you so much for watching and have an awesome day. Here is my reference.